This is a very important word in medicine. Contraindicated. You also hear the word contraindications at times. It means not recommended. So we use it here as an example. You can see clearly that we see a pregnant female with the line between it. We don't want to do radiation on someone who's pregnant if we don't absolutely have to, because it could have some effects on the fetus. I mean, there are times where it's indicated. I've had to perform x-rays on pregnant patients, and it was a direct order from the doctor. They had discussed it exclusively and extensively with the patient. The patient agreed. These are more life and death type situations, things that can't be put off until the baby's born, maybe. And so we do everything we can to protect the baby. But getting back to our word, contraindicated means not recommended. So many radiological procedures are contraindicated. A moment ago, I was talking about contrast, and I said people with iodine allergies shouldn't get certain types of contrast, and that contrast is contraindicated. Maybe there's a medication you've taken once that made you ill. In your chart, it should say that medication is contraindicated for use in your particular case. Very, very important word. Now, it's the other side of it is indicated. So we see indications for things. Someone's nauseated. We can give them a medication to calm down the nausea. That medication is indicated. So we go ahead and use it. But maybe they're allergic to the medication, in which case it may be indicated, but there's a contraindication, so we can't use it. And if that's confusing, I'm sorry. Just focus on this word. It's really what you need to know. Another important abbreviation, you can check out this cartoon if you want. If you've ever worked in an ER, this will make sense to you. If not, it probably won't. It just basically says, allergic or not, if you need to study, we're going to get it done. No known allergies, NKA, an important word in clinical medicine. Here we see, once again, allergy to iodine listed there. So if you ever see that, NKA means simply that, no known allergies, which means if you need to administer a medication, as far as we know, this person will not react to it. You often get surprises in medicine, and I've administered medication to people who've had no known allergies and then watched an allergic reaction happen, but they're rare. So just so you know, it's not that way all the time, but often is. Congenital means present at birth or born with. Acquired means developed after birth. So if you were born blind, it's congenital blindness. If something happened to your neurological system when you're 10, 12, or 60 and you lost your vision, you would have acquired blindness. So either you're born with a disease state, God forbid, then it's congenital, or you acquire it during your lifetime. Diabetes is the same. Type 1 you're born with. Type 2 is acquired. Type 1 is congenital. Type 2 acquired. And there's a note down here, every 15 minutes a baby is born with a congenital heart defect. Sad but true, however, most of those things resolve on their own. So that's the good news. Okay, some random medical terms that you are going to be using throughout the semester, and you might as well learn them now. And so we present them in Chapter 2, and you will be tested on these, so make sure you get them down. An adhesion is a band of scar tissue that binds anatomical surfaces that are normally separated from each other. They're most common after surgery, inflammation, or injury. All three of those situations, be it surgery, inflammation, or injury, are forms of trauma. When there's trauma, there's tissue that's damaged. When tissue goes to repair, sometimes it overdoes it, and it may create an adhesion with another piece of tissue that it's next to. Adhesion may happen as a result of two parts of the small intestine folding over each other, and there was trauma there for whatever reason, maybe surgical. Now, during the healing process, those have grown together, and we can't have them together. So adhesion usually means some type of surgery to separate those structures. Anastomosis is the opposite of this. This is a type of adhesion that is surgically induced, and it serves a purpose, like a heart bypass. Is a great example of anastomosis. It's a surgical connection between two tubular structures to allow flow from one to the other, used to join ducts, blood vessels, bowel segments. And you can see here there's three types. There's an end-to-end, end to side, and side to side. All three are applicable. Once again, somewhere past where you're seeing these sutures being made, there's a blockage, and they're trying to get around it. So in example A, actually, that's not true. In A, they're just putting two ends together of a blood vessel. But B and C illustrate needing to route something around a blockage. So those would be used as it says here, for blood vessels or bowel segments. Pretty common procedure. Sometimes an adhesion is exactly what we want. In this case, it happens to be. To powderize is a procedure that uses either electricity, freezing temperatures, heat, or chemicals to burn abnormal tissue. So maybe some of you have had cauterization done before on skin lesions, or I've assisted in minor surgical things in the clinical setting with cauterizing blood vessels as the doctor is, removing a lipoma or something like that, kind of minor surgery. So it simply is this, though, and this is the definition we'll be looking for on the exam. Inflammation. This is a protective response of body tissue to irritation, infection, or allergy. So histamine gets released in the body. Interestingly enough, this happens with COVID, as a side note, and COVID overdoes this in the lungs. But what happens is histamine gets released into the body. It causes swelling. You see here this cuticle. There's a wound here sort of on the lateral aspect. You can see at the bottom of the picture. That inflammation is there to help seal off those skin pores and seal off that wound site to make sure that no infection can enter it. So this is your body protecting itself and how it protects itself. Like I said, in COVID, our body overreacts, and that's why some people don't survive it as well. The 4 signs of inflammation are redness, swelling, heat, and pain. So inflammation, once again, our suffix for this is itis. I want you to remember that inflammation does not mean infection. Something can be inflamed, but not infected. However, the 4 signs of infection are kind of the same. The difference is you'll have these 4 things, and you'll also see pus or other indications of infection. Usually there's going to be some of a whitish discharge. If you've ever had a small infection in a cut, you've seen that before. Be very careful with that. Before we had penicillin, people would die from very simple infections. However, once again, inflammation is about exactly what it says here. It is not an infection, although it might become one, and although symptomatically they kind of look the same. Inflammation is not infection. Another thing I want you to know, localized versus systemic, especially in medications. So localized is in one area. Systemic is pertaining to the entire body. If you came in with a laceration on your left arm and we look at it and say, okay, we're going to have to suture that up, we'll have to sew it. We're going to give you a localized painkiller in the form of lidocaine. We're going to inject that around the wound site. Maybe some of you have had this experience before. It's kind of stingy and doesn't feel so good. And within a couple of seconds, all of a sudden it gets really numb, and then we can suture it together and stick a needle through it, and you can't feel it. That's an example of localized. It happens in one area. Systemic means pertaining to the entire body. So let's say you come in and you're complaining of pain and in your back, and we're going to give you an anti-inflammatory called Toradol. And that can be taken by tablet, but in the clinical setting, we usually inject it. So that's one in the glute. We give you the injection in your bottom. That will be systemic. It will go through your entire body, but it will only affect what it's supposed to affect. So it's looking for certain indications of where it should be. So systemic will go through your entire body, although it won't affect your entire body necessarily. Localized happens in that one localized area. Sepsis, something very important to be aware of. This is a bacterial infection of the bloodstream or body tissues. It can be life-threatening. Symptoms are fever, elevated heart rate, respiratory rate. So you'll see a fast pulse, and you'll note the breathing is rapid, and there'll be very low blood pressure. Sepsis is something that we still see, but not as often as we used to. Before penicillin, people died of minor infections all the time. My mom was born in 1926, and penicillin wasn't around to the early 1940s. And she lost 2 brothers to infection, one from a sinus infection, believe it or not. It became septic. It was a form of sepsis. Another had a wound, I think, from a rusty nail, and he got tetanus that then became infected and sepsis. So once again, she had 2 brothers who died of infections for things we don't commonly see anymore. I mean, maybe you've had a sinus infection. Hopefully you haven't lost any loved ones to it. But before we had penicillin, infection, if it didn't get under control, would lead to sepsis. And this is an infection in the blood. And these symptoms here are very important to note. If you ever see fever, the heart's racing, they can't catch their breath, and the blood pressure is low, that's emergency room time, unless you're working in the ER, which it's treatment time. So Sepsis, important to know about. We don't see it as often as we used to. However, in the hospital and in nursing home settings, we still see it quite a bit. Here are some abbreviations for you. I'm not going to read them off for you. We rarely use abbreviations in medicine anymore, but some of you, when your careers get launched, will see these in old charts. So it's a good idea to have an idea what they are. Some of these are still used, especially in the quadrants and the chest x-ray I mentioned before. Generally speaking, though, in corporate medicine, which kind of sort of rules our medical field these days, they discourage the use of abbreviations. And the reason for that is you can have an abbreviation that means multiple things. And so you might see PT, might be pulmonary thrombosis, it might mean physical therapy. There's all kinds of things that can be confused. So generally speaking, you won't see them a lot. We still teach them to you so that you have an idea that they're out there and you'll recognize them if you see them. Doctors are usually the only people who are allowed to use abbreviations in charting. Every institution is different. I still use them a lot in my own personal charting. I have permission to do so. Okay, there's the wrap up for Chapter 2. That's everything you need to know about body structure for next week's exam. And just enough medicine to be dangerous. So good luck with your studies on this one. Use your study table. Study guide will be out later in the week. And the next lecture will be Chapter 3, and that's going to be over the integumentary system. So you'll go down to the Chapter 3 study materials header. You'll find that lecture there, and that's where you can that's where you can resume your lessons for the remainder of the week. All right, thanks for your time and attention, and I'll see you over in Chapter 3.